Yes, Bertha.
I agree that the nurse was definitely ignoring and minimizing the situation. The nurse was being very unprofessional. She also did not say goodbye. She just up and left and didn't ask the patient if she had any questions.
Very good job, class. Now for the next video, and remember to jot down what you observe about the situation and what the nurse does right or wrong. Here we go.
To work out the levels and concentrations of different elements in
Sister Rose, is there a Sister Rose?
I'm Sister Rose.
Would you please follow me this way? How are you today?
I'm doing fine. Besides a nagging cough.
So, Sister Rose, what's your date of birth?
June 17th, 1937. Oh! How the years have flown by. Already 72 years old.
Age is only a number, my dear. It's all about how old you act.
Very true. Very true. The students keep me feeling pretty young for 72 years of age.
That's great. You still teach? How are your students?
Oh, spectacular. I don't know what I could do if I couldn't teach them. Just the other day during story time, I was reading to a group of them. This is when I noticed my cough, I suppose. Then I realized that without teaching, I wouldn't have any reason to wake up in the morning.
That's so sweet. How long have you had the cough for?
Oh, since beginning of September, I would say.
All right. Are you experiencing any other symptoms of the cough?
Not really. My nose is like a leaky faucet. But that's been with me for years now. Since I am a teacher, I'm used to running noses and the need for tissues all the time.
I know just what you mean. My little girl just turned 5 and I'm constantly wiping her nose.
I did not realize your mother already, my dear. What's her name?
Her name's Lily. Although she's a handful, I love her to death. I have a picture of her somewhere. Here it is.
Oh, she's the most precious thing I've ever seen. She has your smile and your eyes. There's no mistaking that.
Thank you, Sister Rose. That is very kind. So, back to the cough that's been bugging you.
Okay, dear.
Do you take any other medications?
Just some Tylenol. For a little arthritis pain in my hip. Once in a while. One time, during duties in recess, little Johnny was running around and I tripped trying to stop him. Ever since then, I've experienced some pain in my hip, which the doctor diagnosed as arthritis. Tylenol for arthritis does the trick though.
That's terrible. How badly were you injured?
Well, at the time it was quite painful, but I held up quite fine. I suppose it set a good example for the children as why they should be running. It's dangerous, you know.
I agree, Sister Rose. I tell my little one all the time not to run, but once those little legs just get working, it's impossible to try and stop them.
It is rather a difficult task to complete.
Oh my goodness, we're getting short on time. Okay, so do you smoke, Sister Rose, or have you smoked in the past?
Oh, well, back in the day, before I became a nun, mind you, there was no warnings about the dangers of smoking. In fact, I used to have a smoke with my parents every now and then. I must admit that occasionally I have a cigarette after a stressful day with the children. It's not so much that they are stressful children, but it's just a nice way to unwind after a difficult day.
Sister Rose, please don't feel like you have to try and explain. I know exactly what you mean. I have been trying to keep the habit for the past few months. and it's so difficult. My job can be so stressful sometimes. A smoke break is all I look forward to. Do you have any medication allergies, or are you allergic to any food?
I personally do not have any food or medication allergies. I do, however, know that my mother was allergic to peanuts. I've been lucky not to experience any allergic reactions because I love peanuts.
That's so disappointing. I love peanuts too. Especially love peanut butter. I put it on everything.
Oh, golly dear. I do as well. I always have a spare jar in my cupboard. It has a long shelf life, you know.
What a smart idea. I should start doing the same. Where has the time gone this afternoon? Sister Rose, the doctor will be right in to see you. It's been a pleasure chatting with you this afternoon. I hope your cough clears up real quick.
Well, thank you, my dear. Take care now.
You too. All right, now that you've seen the second clip, can we identify similarities or differences between each video? Yes, you over there.
I noticed that the biggest difference in the clips was the nurse's personality. In the first clip, we saw the nurse was cold and short. In the second clip, however, the nurse was friendly and very personable. This made nurses seem like she genuinely cared about the patient. At the same time, however, I feel like the nurse was too comfortable with the patient and think she was crossing a boundary.
Absolutely. The nurse should not have brought out a picture of her daughter during the consultation. Were there any other significant differences?
The nurse in this clip was professional in that she protected the patient's privacy by bringing her to a private room. The nurse also had better posture and body language, along with making eye contact with the patient.
That's very true, but did anyone else notice something wrong in which the way the nurse gathered the background information? Yes, Bertha.
I did notice that although the nurse was trying to stay on track, she kept becoming distracted. Whether it be by the patient or her own personal stories, it seemed like the nurse had a hard time focusing on the questions. The nurse seemed to only want to gossip rather than get the pertinent information. Then she ran late on time.
Well done, students. You recognize that although the nurse was loving in nature, she was very unprofessional by gossiping and getting distracted. Now, before we watch the third and final clip, how do you believe a nurse in a professional manner should conduct a consultation? Gretchen, again.
I think the nurse should gather the information in a private setting. Always wear their name tag, have their hair pulled back, have proper posture, and not chew gum. The nurse should always make eye contact with the patient.
Oh, Winston!